Bay Sunshine Coast PHN has now released the pre-qualification stage of our tender for our PHN's regional approach to primary mental health within a stepped care approach. This short video will provide you with an outline of the mental health service streams and some information about how to participate in the tender process for primary mental health services. The tender process will consist of 2 stages: a pre-qualification stage for service providers to register their interest and seek information, then a more detailed tender process. The service streams that are covered under this tender include low intensity mental health services for early intervention, child and youth mental health services, psychological therapies provided by mental health professionals to underserviced groups, primary mental health care services for people with severe mental illness in the Wide Bay and Sunshine Coast, suicide prevention aftercare services, Aboriginal and Torres Strait Islander mental health services in the Wide Bay, and central intake and triage. We invite interested mental health service providers to register on the PHN's Tenderlink portal to access all the relevant documentation about the tender process and the service streams. Tenderlink is a free, secure electronic procurement and tendering portal which manages procurement opportunities such as tenders and expressions of interest. All notifications about the mental health tender will be distributed via Tenderlink, and tenders must be submitted via the portal. Service providers can register via the URL on screen. The tender will be a 2-stage process starting with the pre-qualification phase. The PHN will shortlist for most capable eligible bidders who will be invited to participate in a select tender process. Bidders must tender to provide services at a sub-regional level at a minimum, which means that services must cover the entire Sunshine Coast area, Wide Bay area, or Central Queensland area at a minimum. Bids to deliver services across the whole of PHN region are also welcome. The bid must detail how providers will meet the needs of the entire population with particular reference to rural and remote communities. Further details of regional boundaries are available as part of the tender documentation. There are real benefits for bidders in a 2-stage approach. The pre-qualification stage will allow bidders to provide a short executive summary of their proposed model of delivery, nominate their preferred region or regions of service delivery, and provide a high-level indicative budget. The pre-qualification stage includes an organisational governance and clinical quality assurance self-assessment that allows bidders to assess their readiness for delivery of primary mental health care services. We recognise that not all service delivery streams will require the same degree of clinical governance. However, it should be noted that bidders will need to read in detail the briefing paper to understand what their organisation is best positioned to bid for. The 2-stage approach offers bidders time to form consortia bids where partnerships can be formed across sub-regions and service streams to deliver a collaborative and integrated stepped care approach. Bidders will be notified of the outcome of the pre-qualification process via Tenderlink. Bidders who have been shortlisted will then be invited to complete a more detailed tender. The detailed tender process will involve describing the service model, performance indicators and outcomes, establishment, and providing a detailed budget. All consortium bids are to be completed by the lead agency, who will require evidence of consortium arrangements. Successful bidders will be expected to work closely with the PHN and the current PHN commissioned services in the interest of continuity of care and transition. An establishment and transition phase is of the utmost importance to the PHN and to the people who we service through these programs. Clarification questions on the tender process and briefing paper must be lodged in writing through the Tenderlink forum. The PHN will then publish the question and answer on the Tenderlink forum for the benefit of the entire bidder pool. bidders are strongly encouraged to read the briefing paper and supporting documents in detail before submitting any clarifying questions. The timeframes for Stage 1 can be seen on the screen. And the timeframes for Stage 2 can also be seen on the screen. The PHN does reserve the right to change timeframes and withdraw service offerings. Please refer to the conditions of participation that can be downloaded with this notice through Tenderlink. We understand that many of you are very supportive of effective primary mental health services, and we appreciate your continued support and goodwill in our communities. Thank you for your interest, and we look forward to receiving your bid.